Joining us now is Dr. Bayo Curry-Winchell. She is a physician and health equity advocate. Great to see you again, doctor. So let's just start with which medical appointments should we consider scheduling now to try to get ahead or stay on top of our health?
First, I would recommend getting that annual checkup. This is a perfect time to talk about any concerns, any lifestyle changes. The other thing I would recommend is getting a dental exam. A lot of people aren't aware that dental infections can increase your risk for heart disease, other factors as well. The other thing I would look at is getting an eye exam. Yes, our eyes change as we go through life, but also there can be other diseases such as glaucoma or diabetes that could be affecting your eyes. So these are great starts. And the other thing that I recommend are screenings, mammograms, colonoscopy. If you are over the age of 40 or 45, this is a great time to get those checked out.
Love that. What about blood work? What should we be paying extra attention to, especially as we start getting older?
Well, I recommend starting with the CBC. That will check to see if there's any signs of anemia or infection. Another thing that's really great to get is your thyroid, because sometimes people might feel like, oh, I'm feeling a little tired. Maybe it's just, my daily activities. Well, it could actually be due to your thyroid. So that's a big one. The other one I highly recommend is if you are over the age of 20, you want to get your cholesterol checked out. High cholesterol is linked to heart disease, and it's often a silent thing that happens, and you may not know unless you get your blood checked. So those are really great things to start with.
I got a practical question. My primary care doctor actually just left practice, and I had to book 6 months from now for an appointment with somebody. What is the way to find a primary care doctor if you don't have one? Is there a trick?
There are. So first, you want to really look at who is in network for your insurance, just to make sure that you're able to see them. The other thing is asking friends, who do you like to go to? That can be a great resource. The other thing I recommend is really thinking about interviewing that physician. So you have an appointment, make sure it's the right fit, because in the end, your health is your most prized possession, and you want to make sure that person is really the best fit for you.
That's a great tip. And one of our tips up here at Leverage Insurance Provider Networks, reality is some people don't have health insurance too. How can they find affordable alternatives to help them stay up to date?
So you want to look around. Online is a great resource. There's a lot of things, especially when we talk about public health or community resources, that are available to allow you to be able to see a physician or get the screenings that are needed. Especially as we age, there are different things that are available. So really looking online, talking to your friends can be a great option.
So new insurance, if you do have insurance, often kicks off at the start of the year, like where we are right now, like if you're switching plans. So you might have to switch doctors then. How do you make sure that, this is a big question, that all your doctors know what's going on, that they're all looped in, especially if you're in different networks?
It can be difficult, but first, what I say is start with looking at those apps or those portals that really help you kind of know which doctor you've seen before and which one you're going to see moving forward. The other thing I highly recommend is creating your own medical binder. That means any person that you see, any specialist, really writing that down and then going in and making sure you have that binder so everybody can be connected.
I feel like I just got a gold star from the doctor. I have a little medical folder.
Oh, you already have? Of course you do.
I just updated it.
You're so organized.
I love that. Any other just start of year tips that you want to leave us with?
Yes, the more you know, the more you can do about your health. So don't allow fear or anxiety to stop you from getting to know your health and being able to stay healthy in the new year.
Dr. Bayo Curry-Winchell, great to have you as always. Thanks so much.